Candace Johnson is president and CEO of Roswell Park Comprehensive Cancer Center in New York. She worked closely with Cuban scientists to bring their lung cancer vaccine to the U.S. for trials. And she is joining me now. Welcome to the program, Candace Johnson. So let me ask you first. You know, everybody knows Cuba and the United States at loggerheads. Diplomacy, has been disrupted. There are sanctions. It can barely pay for its, daily bread. And yet, over the decades, it's been really standout on the biomedical front. Why is that, do you think?
So, Cuba has really distinguished itself in some of the most preeminent immunologists. These individuals are some of the brightest and most innovative scientists that I've had the pleasure to work with. And, Cuba was sort of forced into this because they didn't have access to the drugs that you might get in Western countries. And so they developed the technologies to vaccinate their own people against a whole variety of things. We were obviously interested in their development of a lung cancer vaccine, but it is no surprise to me that they're on the forefront of a COVID vaccine. They're truly remarkable people.
So tell me, it sounds everybody's going to be pricking up their ears at the sound of a lung cancer vaccine.
Yes.
What exactly is it? Is it preventative? Is it therapeutic? And how have they been able to do it, and how have you been able to get it?
Yeah, well, that's the genius of the Cuban scientists. So lung cancer, as we all know, there's some new and novel approaches out that can increase someone's survival even in late-stage disease. But lung cancer, most of the therapies, at least a number of years ago, were focused around this one growth factor receptor. And they didn't have access to any of those drugs, and so they hypothesized, I wonder if we could immunize people against this particular growth factor. And this growth factor, the lung cancer cells are addicted to this growth factor. And so when the growth factor is present, the tumor grows. If you could prevent the presence of that growth factor in the patient, perhaps the tumor would stop. And so the real genius of this is immunizing someone against a protein that's natural to their body is no easy task. And that's why, I'm sure that's why their COVID vaccine was so successful, because they developed a technology to take that growth factor and conjugate it to a very unique protein and then immunize people against this growth factor. And lo and behold, they demonstrated that patients had a very strong immune response and developed and actually depleted the levels of this growth factor in these lung cancer patients. No growth factor, the tumors don't grow. It was genius. And they did studies in Cuba. They've done studies in South America. They actually had gone through phase 3 studies. These results were published actually in an American journal. Their rigor was just as rigorous as in the States. Many of these scientists presented these results at national meetings. We wanted to bring this vaccine to the United States. And so back in 2015, we started the procedure to do exactly that. And today, it took a while for us to do that. And today we have clinical trials open here at Roswell Park and also at a number of other institutions in New York State, and hope to open them in some other institutions around the country. And we've already validated some of the initial concepts about this drug.
And again, I think it's really extraordinary to hear you talk about that. When you talk about the immune factor, the growth protein, etc.,
yes.
Are you talking about immunotherapy, which we hear a lot about in trying to treat cancer these days?
Exactly. This is a form of immunotherapy. Anything that you use to stimulate the immune system is immunotherapy. And so this is just a different kind of immunotherapy. And the one promise that we think Simivax, which is the name of this drug, may have is actually in prevention. So say you have lung cancer, it's very isolated, early stage disease. You can actually cut it out with surgery and remove it. But we know that those patients are at very high risk for recurrence. So you reduce the tumor burden, if you will, in the individual. You immunize them with Simivax. They have these circulating antibodies against this growth factor, and therefore they get no recurrence. And we actually think that this has great promise, and we're about to initiate a new trial to look at this in our patients. Very exciting.
And just to be clear,
Yes.
Candace Johnson, is this the only source of this Sinovac lung cancer therapy vaccine? Is it only from Cuba?
Only from Cuba. Yes, indeed.
Wow.
And yeah, no, I know and you know the thing that is so remarkable is that Cuba does not have the Cuban scientists, who are, in my mind, innovative, brilliant. They're always thinking out of the box. They're always trying to think very innovatively, how can they solve a problem? They don't have the advantages that maybe we have in this country of fancy equipment, all these very expensive reagents. They actually have to use their head and figure out how to attack these problems. And they've been very successful at this. And so we're very excited to have this collaboration. As you could well imagine, during COVID, things have sort of been put on hold, but we're anxious to see COVID come to an end so we can continue our collaborations with these wonderful folks.
Yeah, and their COVID vaccine, the Sovereign 2, is, as we discussed, I think it's about to head into its final phase of trials. And then, as we said, they have said that they want to export it as well as immunizing their own people, clearly, and offering it as sort of tourist vaccine package holidays to Cuba as a way to reboost their shattered economy. You've been there a lot. I know you've been to Cuba, you've spoken to the scientists, you've looked through your professional lens at what they're doing. Talk to me a little bit about their soft power in terms of vaccine diplomacy and medical diplomacy. Over the decades, they have exported this thing that they do so well.
Yes, they have, the science and especially applied science. So these immunologists very much are developing preventative measures for their citizens. They're always thinking about, it's purely for the good of their mankind. They obviously want to export this knowledge and help other folks around the world, but their motives are really to help their citizens in the development of these vaccines. And so it was really, when you go to Cuba and you see the dedication of these scientists and you see how really innovative they are and what they do with much less than we do even in my own institution, it really is, it's awe-inspiring, and we really treasure those relationships we have. And it's not, Sinovac is a very interesting lung cancer vaccine, but there are other things that they have that we could avail ourselves here in this country, and we're going to hopefully be a conduit for some of those things as we go forward.
Like, give me one sneak peek of a major breakthrough vaccine that they might give you.
Well, they have another vaccine involving the use of the immune system that may have application in a wider variety of tumors than just lung cancer, and so we're going to explore that as well. They have a lot of innovative drugs that they're working on.
Everybody knows, and I'm going to do the cliche, I'm going to play the pictures of the old cars that they have been repairing and keeping on the road for decades, many of them old American cars. Yeah, and I'm going to read you what the director of the Cuban neurosciences said. Cubans are not only able to make old cars still work, they can manage to make old equipment work too. So as you've said, they've had to work with subpar, I guess, equipment, but nonetheless raising their game scientifically. And they've also been sending doctors, and we've got images of that too, during the COVID pandemic to places like Italy. We've got pictures of them disembarking in Italy in the spring of this year when the pandemic was so bad. Can you just sort of wax philosophical, if you like, on their role, and Russia's role, and China's role, and India's role in trying to get this vital medicine to the countries that can't afford it? And we know from the figures that the rich countries have already bought up billions of doses of COVID vaccine, and the poorer countries in the developing world just don't have that access.
They do not. I mean, you know, if you would look at the Ebola outbreaks in Africa, who were the physicians that were there on the front lines? It was the Cuban physicians. So they're always there in those instances. And they did play a very important role in Italy. And I think they see their place. You know, we're all people. We're all here for the betterment of mankind. And I think the Cubans take it perhaps to an extra step because they're truly dedicated to try to help people, especially people that are suffering from devastating diseases.
I mean, this is a political question, but do you regret that they are targeted by your country, that, you know, the Obama administration did restore diplomatic ties, the Trump administration did not? I don't want you to talk politically. I just want to talk sort of scientifically and medically about, could you perhaps get more if it was a different political situation, or is it because they are under such pressure, as we've kind of discussed, that they actually are so ingenious in this field?
Well, it's a very interesting question. And actually, throughout, you know, we started this, as you say, in the Obama administration and went through different presidents. But all the way through, regardless of who was sitting in the White House, we still managed to visit each other. We still managed to continue our collaborations. We had to be a little bit more inventive about how we did it, but we still managed to achieve and to be successful. And I think that it probably does go a little bit to the heart and soul of the Cuban scientists, and it makes them maybe a little bit more thinking outside the box because they have to, because of the situation. But we try to just focus on developing these drugs to help Americans, and potentially we have things here in this country that could really benefit the Cuban people that they just have no access to. So we're hopeful that through these collaborations, we can be there for each other. We're all people here.
It's really an amazing medical success story, and really an example, really, of humanitarian and medical diplomacy and bridge building. Candace Johnson, thank you so much for joining us. A really fascinating story.